Before you go to sleep tonight, I want you to pay attention to one simple thing: the position your body is in when you spend 6, 7, or even 8 hours resting. Most people think sleep is only about closing their eyes and getting enough hours. But the way you position your body during sleep can affect breathing, circulation, comfort, and how your body handles the night. And for older adults, this matters more than many people realize because as we age, the heart, blood vessels, lungs, and muscles that support circulation naturally go through changes. A sleeping habit that seemed harmless for years may no longer feel the same after 60. Many older adults wake up feeling heavy, tired, short of breath, or uncomfortable and simply assume this is just part of getting older. But sometimes your body is giving you information. The good news is that a few simple adjustments to your sleeping habits may help support better rest, healthier breathing patterns, and improved comfort during the night. Today, we are going to talk about what science says about sleeping positions, heart health, circulation, and why one position may be more comfortable and beneficial for some people than others. By the end of this video, you will understand how different sleeping positions affect the body, what researchers know about side sleeping and heart function, which warning signs should never be ignored, and practical steps you can take tonight to create a safer and healthier sleep routine. Hi everyone, I'm Dr. Sophia Adams and welcome back to the channel. Here, we take the health concerns many older adults are told to simply live with and explain what may really be happening inside the body using clear science, practical advice, and simple steps you can apply in everyday life. If you are over 55 or you care for an older loved one, this information is especially important because sleep is not just a time when the body rests. It is a time when the body repairs, regulates, and restores itself. Now, before we talk about the sleeping position that may support your heart and circulation, we need to understand something important. There is a common belief that one sleeping position can completely prevent a stroke, heart attack, or blood clot. That is not true. No sleeping position alone can guarantee protection from serious health conditions. Your overall heart health depends on many factors, including blood pressure, cholesterol levels, physical activity, diet, medications, diabetes management, smoking habits, and medical conditions. However, your sleep position can influence certain things that matter for health, such as breathing quality, pressure on the body, acid reflux, comfort, and symptoms related to some heart and lung conditions. And this is where many people are surprised because the position you choose at night may affect how your body feels when you wake up. Let's start with something many seniors do without thinking: sleeping flat on the back. For many people, lying on the back is completely comfortable. However, for some older adults, especially those who experience snoring or sleep apnea, this position may allow the tongue and soft tissues in the throat to fall backward more easily, which can narrow the airway. Sleep apnea is important because repeated interruptions in breathing during sleep can place stress on the cardiovascular system. According to the National Heart, Lung, and Blood Institute, sleep apnea is associated with increased risks related to heart health, including high blood pressure and other cardiovascular concerns. This does not mean everyone who sleeps on their back has a problem, but if you wake up frequently, gasp for air, feel extremely tired despite sleeping, or your partner notices loud snoring and breathing pauses, it is something worth discussing with a healthcare professional. Now, let's talk about side sleeping. Many experts consider side sleeping a comfortable option for many adults because it may help keep the airway more open compared with sleeping flat on the back. For people with certain breathing issues, this position may reduce some symptoms. But which side is better? This is where things become interesting. Some research has explored how sleeping on the left side may affect heart position and circulation, especially in people with certain heart conditions. The heart sits slightly toward the left side of your chest, and body position can change how gravity affects the heart and nearby structures. Some individuals with heart failure report feeling more comfortable sleeping slightly elevated or on their side rather than completely flat. However, there is no universal rule that every person must sleep on the left side. Some people actually feel uncomfortable in that position. Others may prefer the right side because it allows them to breathe more comfortably or reduces discomfort. The most important thing is understanding your own body. So let me ask you something. When you wake up in the morning, do you usually feel refreshed or do you wake up tired even after a full night of sleep? If you are comfortable sharing, write your answer in the comments. Your experience may help others realize they are not the only ones dealing with this. Now, let's talk about blood clots and thrombosis. Many people worry that sleeping in one position overnight will automatically cause dangerous blood clots. The reality is more complicated. Blood clots are usually connected to multiple risk factors, including limited movement for long periods, certain medical conditions, surgery, obesity, smoking, some medications, and genetic factors. A healthy person changing sleeping positions throughout the night is not usually at risk simply because they stayed in one position while sleeping. However, for people who are already at higher risk, movement and circulation habits during the day become extremely important. The body is designed to move. Your leg muscles act like a pump that helps blood return toward your heart. This is why prolonged sitting or immobility can become a concern. According to the Centers for Disease Control and Prevention, deep vein thrombosis occurs when a blood clot forms in a deep vein, commonly in the leg, and certain risk factors can increase the chance of developing it. The lesson here is not to become afraid of sleep. The lesson is to understand your complete health picture. Your nighttime habits matter, but your daytime habits matter too. If this information is already helping you understand your body more clearly, please tap the like button. It helps YouTube share this video with more older adults who may have the same questions about sleep, circulation, and heart health. And if you have noticed changes in your sleep as you have gotten older, share your experience in the comments. I read these comments because they help guide the health topics we discuss next. Now let's look at some practical ways to make your sleeping position work better for your health. The first thing to consider is comfort and breathing. Your best sleeping position is one that allows you to breathe easily, reduces discomfort, and helps you get consistent quality sleep. If you wake up with chest discomfort, unusual shortness of breath, dizziness, or extreme fatigue, do not simply change your pillow and ignore it. Those symptoms deserve attention. The second thing is supporting your body correctly. Many older adults sleep with pillows that do not properly support the neck and spine. A pillow that is too high or too flat can create tension, discomfort, and poor sleeping posture. Side sleepers often benefit from a pillow that keeps the head aligned with the spine. Some people also find comfort using a pillow between the knees to support the hips and lower back. The third thing is paying attention to nighttime breathing. Snoring is common, but loud snoring combined with choking sensations, morning headaches, or daytime exhaustion may be signs of a sleep-related breathing problem. The American Heart Association highlights the importance of recognizing sleep disorders because poor sleep quality can affect cardiovascular health. The fourth thing is creating movement habits during the day. Even if you sleep in the perfect position, spending most of the day sitting can affect circulation. Simple activities like walking, stretching, and moving your legs regularly can support healthy blood flow. The fifth thing is reviewing your medications and health conditions. Some older adults take medications that influence blood pressure, fluid balance, or sleep patterns. Never stop or change prescribed medication because of something you hear online. Instead, speak with your doctor or pharmacist if you notice changes in your sleep, swelling, breathing, or energy levels. Now, before I give you the final steps, I need to say this clearly because your safety matters more than anything in this video. Seek medical advice promptly if you experience new or worsening chest pain, sudden difficulty breathing, sudden weakness or numbness on one side of the body, trouble speaking or understanding speech, sudden confusion, severe dizziness or loss of balance, swelling, warmth, or pain in one leg, especially if it appears suddenly. These symptoms can be signs of serious conditions and should not be ignored. This video is for education only and does not replace personal medical advice from your healthcare provider. So what can you do tonight? Start with these simple steps. First, Choose a sleeping position that allows you to breathe comfortably and reduces pain or pressure. Second, make sure your pillow supports your neck properly. Third, if you suspect snoring or breathing interruptions during sleep, talk with your doctor. Fourth, keep your body active during the day to support circulation. Fifth, manage the health factors that have the biggest impact on your heart, including blood pressure, blood sugar, cholesterol, and regular checkups. And finally, listen to your body. Your body often gives small signals before bigger problems appear. Feeling tired all the time, waking up breathless, experiencing unusual swelling, or noticing major changes in your sleep pattern are messages worth paying attention to. Many older adults become frustrated because they do not know what is normal aging and what deserves medical attention. They worry about being seen as complaining. They worry that changes are simply part of getting older. But understanding your body is not worrying too much. It is taking responsibility for your health. Growing older does not mean ignoring symptoms. It means becoming wiser about the signals your body sends. What I want you to remember is this: your sleeping position is only one small piece of your overall health. The strongest protection for your heart and circulation comes from the daily choices you make: staying active, managing health conditions, eating well, sleeping consistently, and speaking with healthcare professionals when something feels different. If this video helped you understand your body a little better today, please hit the like button. Tell me in the comments, what sleeping position do you usually use, and do you feel rested when you wake up? Subscribe and turn on notifications because every week, Dr. Sophia Adams breaks down senior health concerns in a calm, practical, and easy to understand way. And if you want to learn more about protecting your heart after 60, watch the next video on your screen now.